Now we're excited to learn from Dr. Connor, who's been paramount in conducting the clinical studies and documenting the positive benefits people have experienced with our all-new X2O, light-infused water technology. Thank you, Dr. Connor, for taking time out of your busy schedule to be with us here today.
Hi, I'm Dr. Connor, and I'm here today to talk to you about the first 4 studies we did on the X2O water technology. First, I want to say a special thank you to LifeWave and to the attendees of this conference. Starting with the first study we did, it was a randomized controlled sample of 20 individuals. They were made up of men and women aged 21 to 81, and the testing on each individual person took approximately 2 hours. The water for that study was treated for approximately 45 minutes. The 20 people were split into 2 groups. The first group got the energized water by itself, and the second group also got a magnesium-based commercial detoxification product, which was added into the water. For that particular study, we did a number of different tests. We did baseline measures and questionnaires. Those were actually done at consenting, which was done prior to the main testing. We did a urine sample where we were looking at amino acids, and we did weight with interstitial age. We also took near-infrared images, base temperature, blood pressure, oxygen saturation, and we did drops of blood on slides that we looked at under a microscope. We also did point measures and a physiology suite, including HRV. The acupuncture results for that particular study, when you grouped both groups together, showed a significant change in DO14, DO20, and large intestine 4. It was particularly interesting on DO14 because there's very little change between the pre-testing and the baseline testing. The baseline testing we did at consent. And there was a significant drop at the post-testing. That particular point is a crossing point for pretty much all of the Yang meridians. So it's interesting that it decreased. It probably suggests that people relaxed as they went through the study. In contrast to that, DO20, which is on the top of the head, and large intestine 4, we saw a significant increase throughout the process. When you split the 2 groups apart, you get slightly different results. We still see a significant change in DO14 and in DO20, but instead of large intestine 4, we see a significant change in spleen 6. You can see here that, again, we have that significant drop in DO14, but we see a somewhat different picture with DO20 because it has an arc instead of a clear upsweep. And spleen 6 also has an arc. So you can see that there are changes that are made by the addition of the magnesium detoxification product. We also saw very clear changes in the heart rate variability using the Thought Technology Biograph Infinity Physiology Suite. There were 18 of 20 cases where we saw the changes in the heart rate variability in under a minute from the start of ingestion of the energized water. The fastest response was actually within 10 seconds. The majority were within 30 to 45 seconds, and the last 2 people, the last 2 of the 20, we saw a change in under 2 minutes. So this is a very, very rapid response time. There was also a significant change in the blood volume pulse and the HRV response in Epoch 2. So epochs on that particular device are 1 minute long. It's a way of dividing up when you get a change. And there was a clear improvement in heart rate variability in all participants. The changes in that one were not different between the groups. In terms of vitals, temperature, oxygen saturation, pulse, and blood pressure, which we separated into systolic and dystolic. Those are the top number and the bottom number. We saw significance in the oxygen saturation. It improved or didn't change, which has actually been consistent throughout the studies. It's very good. And we saw the pulse rate shift. Again, we're probably seeing a relaxation. And the diastolic, the bottom number in the blood pressure, also dropped, suggesting, again, the relaxation effect. You can see on these graphs that the way that the groups cluster. So there's in the temperature, there's not a huge amount of shift in the baseline pre and post in group 1, and you get a little bit more of a broadening in group 2, and actually a narrowing in oxygen saturation in group 2. Systolic and diastolic blood pressure, you can see, are very similar throughout the process, though diastolic, again, you have this narrowing sweep. We also saw some significant amino acid changes. Those were in sarcosine, valine, histidine, B-alanine, leucine, 3-methylhistidine, proline, and I never get the pronunciation on this one right, kynurine. So we got significance in a number of different amino acids in under an hour. Because the full testing took 2 hours, half of that was the pre-testing, half of that was the post-testing. So from when people drank the water to when we did the amino acid test, the urine test, was 1 hour, which is a very rapid amount of time to see a change in amino acids. In water 2, we again looked at a randomized controlled sample of 20 individuals, and again it was men and women, aged 21 to 81. Testing again took approximately 2 hours, and the water was treated for approximately 45 minutes. However, for this study, one group had normal distilled water, and the second group had the energized water. For this study, we kept a number of the tests the same. We did questionnaires, which were different from the first study. We looked again at weight with interstitial age. We added a sit-stand test. We kept the base temperature, blood pressure, and oxygen saturation. The point measures, we actually added some things for the point measures. We added bioelectric magnetic measures, and we kept the near-infrared images and the physiology suite looking at HRV. In the HRV, again, we looked at HRV, EEG, which is it's a measure of heart rate, EMG, which is muscle tension, temperature, galvanic skin response, and blood volume pulse. And we saw significant changes in EKG. Again, that's that heart rate, EMG, the muscle tension, skin conductance, respiration, and what's particularly interesting in this case is there was a significant decrease in the control group, and the active group actually stayed the same. And I don't know entirely what's going on with that, but that's not normally what you would expect. You wouldn't expect the control group to drop significantly. So that was very interesting. We also saw a significant change in body age as measured by the interstitial resistance, specifically in the active group. You can see on this table here. And again, looking at the acupuncture points, we saw a significant change in spleen 3 and liver 3. Now, this was looking at the AcuGraph, so we were using a different method of testing the acupuncture points than we had in the first test. The first study, we looked just using a data logging multimeter. In the second study, we did a comparison. We used the AcuGraph, the data logging multimeter, and a Excel 2 pointer, which also measures a variety of different things. So it was very interesting looking at the difference in the different methods in the results that we got. We also saw a significant change on the right side, the stomach 42 point. Looking at the data logging multimeter, we saw a significant change in DO20 again, pericardium 6, kidney 1, and amnion. And pericardium 6 is interesting because that's specifically in the control group. Again, we're probably seeing a relaxation effect as people were enjoying participating in the research study. I hope they enjoyed participating in the research study. On this next slide, you can see some of the significant data. So you can see the body age, how that's shifting. You can see the liver 3, spleen 3, and the stomach 42 points. And we have the control group pre and post first, followed by the active group pre and post. So you can get a clear idea of how each of them shifted. Here we have DO20, pericardium 6, kidney 1, and amnion from the data logging multimeter. And again, you can see Pericardium 6 for the active group stayed very, very consistent, and there was a clear shift in the control group. In contrast to that, kidney 1 in the active group has a very clear change, as does Onmion. Using the BioWell, there were significant changes in intestine, spine, brain and nervous system, immune system, hormones, lungs, kidney, liver, and urogenital, which frankly covers most of the body between them.
What's better than hearing from Dr. Caitlin Connor on the amazing benefits people are experiencing with the new X2O light-infused water technology? Hearing from her twice. Back with more of her incredible findings, please welcome back Dr. Caitlin Connor to the virtual stage.
Moving on to the third water study we did, we again looked at a randomized control sample of 20 individuals, but here we shifted the age. We were still looking at men and women, but we shifted the age to 40 to 90. Testing again took approximately 2 hours. The water was treated for approximately 45 minutes. Group 2 had no additives to the energized water. Group 1 had citrulline and sulforaphane added. Citrulline was added into the water, sulforaphane was in a tablet that they took at the beginning of the study. Now, this particular study was double-blind, which meant that everyone was given a tablet at the beginning of the study. The people who were in the no supplement added group got a cellulose tablet instead of the sulforaphane. For that particular study, again, we kept some of the same tests and we added some new ones in. We kept the weight with interstitial age, we kept the base temp, blood pressure, and oxygen saturation. We added glucose. We kept the bioelectric magnetic measures. We added the biopulsar. We added a Doppler perfusion imager, and we kept the near infrared image and the physiology suite HRV. The physiology suite, again, we saw a significant change in EKG in both groups. That's the heart rate variability. And in group A, the supplement group, we also saw a significant change in the skin conductance. And in the no supplement group, we saw a significant change in temperature and respiration. We saw, again, the oxygen saturation improving significantly, which is always a good thing to see, and in both groups by about the same amount. So it's always nice when you don't have people breathing more shallowly throughout the research study. We saw a significant change in weight. You may notice that the weight goes up. It actually went up the same amount in both groups because we had both groups drinking the same amount of water, and water has mass. So both groups went up in weight by the amount of the weight of the water. BMI, interestingly enough, is not the same between the two groups, and I have no explanation for that either. We did see a significant change in BMI, but not to the same level, which is interesting because BMI is effectively a math calculation of your height and your weight. And the weight should have shifted by the same amount and the height shouldn't have shifted at all. kcal, we also got a significant change in the amount of calories burned changed. So that's interesting. Hold on to that one because that'll come back when we get to glucose. And again, body age is doing some interesting things. We did see a shift, not to significance, but we did see a shift in the group A. Again, weight changed by the same amount because we were having them drink the same amount of water. And here, BMI has shifted less. I can't explain that. kcal hasn't moved to the same degree. And body age, here we're seeing a significant shift. On this next slide, you can see the shift in the oxygen percentage. So we have, again, we have A pre and post together and B pre and post together. So you're seeing in combination how they both move. And you can see both of them went up quite nicely. The weight, you can see, shifted the same amount. And BMI was actually slightly different between the two groups, despite being randomized, which can happen, but didn't shift quite the same way. kcal, you can see, you have a difference, again, in terms of how it's moving, and body age is a very, very clear difference between the two groups. Looking at the biopulsar, we saw significant changes in nose, hormone system, immune system, intestines, joints, urinary system, stomach, and lung. Again, that just covers most of the body. And bio-well, we again saw brain, spine, coronary vascular system, intestines, urinary system, hormone system, immune, and face. Just everything. Water Study 4 was a different design. It was a double-blind crossover design. Now, what that means is you have people coming in for 2 visits. One of the visits, they were drinking the active water. One of the visits, they weren't. And it was randomized which of them they were doing first. And because it was double-blind, they didn't know, and neither did we. We had one person on the team whose only job was doing the water, and they'd hand the people who were taking the data the cup, and the people taking the data had no idea whether it had been energized or not. This was a randomized control sample of 50 individuals, so it was a little bit bigger. And again, we were looking at men and women aged 40 to 90. Testing again took approximately 2 hours, and the water was treated for approximately 45 minutes. Group 1 had the energized water first, while Group 2 had the energized water second. We again did the amino acid urine test, the weight with interstitial age, the base temp, blood pressure, oxygen saturation, and the glucose, and we added a carbon dioxide measure. We did the dark field microscopy, the slides with the drop of blood under a microscope again. We did the bio-well, the biopulsar, the Doppler perfusion imager, and the HRV again. For the physiology test, again, we got a significant change in skin conductance, in EKG, that's the heart rate variability, in temperature, and in the respiration rate. And we saw BMI change significantly less in the active group, which again is very interesting because we saw the weight again change by the same amount in both groups because they're drinking the same amount of water. Water has mass. So the fact that the BMI changed differently in both groups is very interesting given, again, it's a math calculation. It's height by weight. They should have changed the same amount. And this is a very, very significant number. It's 3.258 continuing E negative 10, which means that you move the decimal place over 10 points. It's a lot of zeros. P-values, you want to see a lower number, if at all possible. The p-value shows how likely something is to have happened randomly. So the less likely it is that it was random, the more likely it is that it was caused by what the intervention was, in this case, the energized water. So 10 zeros is a lot of zeros. Muscle percentage also went up in the active group, P equals 0.008. Diastolic blood pressure decreased significantly in the active group, P equals 0.04. So in general, statistical significance is considered anything less than 0.05. Just keep that in mind. Oxygen saturation increased significantly in the active group, P equals 0.04, and glucose significantly decreased in the active group, 0.03. And glucose was actually kind of funny. It was enough of a visible shift that the people taking the data, the research team, actually started guessing which group people were in based on the glucose shifts. So it was fairly visible on the monitor. We also saw 12 significant amino acid changes and 3 that were near significant. The amino acids we saw change were cysteine, methionine, alpha-aminobutyric acid, tyrosine, phenylalanine, hydroxyproline, and oxoproline, as well as serine, anserine, arginasuccinate, alanine, citrulline, glutamine, cystathionine, adenyl homocysteine. Between the different studies where we were looking at acupuncture points. The DO channel was particularly reactive in both studies. DO 14 showed a significant decrease in both when analyzed with the groups combined and in the water-only group in study 1, while DO 20 showed a significant difference in both when analyzed with the groups combined and in the supplement added group. It also showed a significant change when measured by the data logging multimeter in water 2. It did not show that in the AccuGraph. So there's some interesting differences in the method of testing. We were using the data logging multimeter in water 1, so it makes some sense that that would be consistent. The physiology suite, again, we did through all of the different studies, and all of the studies showed a significant improvement in EKG in the energized water groups. That's the heart rate variability. And all of the studies showed a significant change in skin conductance in the energized water groups as well. Supplement effects varied by supplement, which makes sense because the effect of the supplement is going to depend on which supplement you are using. It suggests in this case that the energized water provides a very good base, and you can tune exactly what it's doing by the supplements that you add or potentially don't add. In terms of vitals, we saw oxygen saturation either not change or increase in any of the energized water groups. We saw diastolic blood pressure decrease significantly in 2 of the studies in the energized water groups. And we saw kcal and glucose changes, which suggests that there may be metabolic changes, especially in combination with the amino acid changes. In the BioWell, looking across all of the studies, we saw changes in the spine, the brain/nervous system, the intestines, the hormone system, the immune system, and the urinary system. Some fairly important systems for how your body works. So it looks like drinking this water improves energy production and energy flow in the body. And the changes in the body show up almost immediately after consuming. Again, we saw changes in all cases under 2 minutes, and in most cases under 45 seconds. There are measurable improvements in the way that the body metabolizes specific amino acids, and this could lead to improvements in peptide and protein synthesis. We specifically saw in the amino acid changes that there were 3 amino acids that shifted that have direct links to DNA. So the potential implications there are very interesting. And while the changes in amino acids were not identical between water 1 and water 4, we did get 3 that were exactly the same, and we got a number of other amino acids that are in the same chain. So amino acids don't stay static when they're in the body. They get used and they get turned into other things. There are a whole bunch of different processes going on. So it looks like it's activating specific pathways, and the exact amino acid we get a significant shift on may depend on when we're hitting that specific pathway. Some of the data also suggests an anti-aging effect and improved metabolic function. The effects are systemic, not localized, which was very clear with the BioWell and the BioPulsar results. We will perform long-term studies once the machines are available to validate the anti-aging benefits. We have continued doing research on this particular technology after the 4 studies that I've talked about here, though they're not quite ready to be presented yet. And we will continue to do that. Thank you.